name is Kelly. I'm a student physical therapist assistant from FSCJ. Today we are going to be talking about spinal cord injuries in the acute phase of healing. So I have my patient already laying on the table. So we're going to start with some passive range of motion. So passive range of motion is very important for these patients because it helps prevent contractures of the muscles, and it allows for blood flow, and it just allows for the muscles to still get moving. So I'll go ahead and show you that. So what I would do is I would just take the leg, and you want to make sure you have good body mechanics yourself as you're doing this. And so you're just taking them through a range, stretch out the leg, and then you can even move on to the arm if they need passive range of motion here, just taking them through that range like that. Or if they need shoulder mobility, just taking them through a range like that. Next, you can work on rolling with the patient. That helps them prepare for bed mobility, and it also allows them to, if they have pressure ulcers or the beginning signs of it, they can have that for pressure relief because they should be changing position every 2 hours. So I would instruct the patient, and of course you want them to be able to do as much as they possibly can do, and then you're here to help them. So before we get started, I would cross the patient's ankles. So since she's rolling to her right side, I cross this leg over, that way when she rolls, her legs are cleared. And then I would have her just work on a chopping motion. So you want to have them feel what it feels like, and then obviously they will use momentum to help them go through that range. And the goal is to have them lying on their side, and then from there we can help them get to that seated position. So then as they're doing the chopping motion, I would have her go ahead and roll. And I have the key points of contact, so I have a hand on her shoulder, a hand on her hip. That helps give us that stability there. And then from here, I would just go ahead and help her sit up. So I'm gonna bring your legs down, and then I'm gonna get you into that seated position. 3, 2, 1. Okay, so now that I have my patient in the seated position, I'm gonna work on static balance. That's the first thing that we would start to work on with this type of patient. So I would have her started, I'd be guarding her, making sure that she's safe. I'd have her start working on just seated balance in that tripod position. And then from there, based on the patient's abilities, I would have them put their hands more in their lap to help kind of challenge them a little bit more as they progress through their plan of care. And so with that, I would also instruct the patient on diaphragmatic breathing. That can help them with energy conservation, and it can help them with chest mobility and making sure that there's still lung expansion happening. So I would instruct them to take a deep breath through their nose and expand the breath through their belly instead of their chest, and do a count of 5, and then you can do, even on the exhale, do a pursed lip breathing. Helps with gas exchange, especially if they are having difficulty getting those deep breaths like they used to. So go ahead and take a deep breath of 5, expand that belly, and then breathe out. And that's something that they can do throughout any of their exercises that they're doing. It can just help them with energy overall.